Hello guys, welcome to EM Rounds. Today we are going to discuss how you can read a C-spine X-ray in a case of trauma in just 60 seconds. The mnemonic is ABCDEF, where A stands for adequacy and alignment. You look at the adequacy of a cervical X-ray, whether it is extending from the base of skull to the C7-T1 junction. And for alignment, in lateral X-ray, you draw three lines: the anterior vertebral line, the posterior vertebral line, and the spinolaminar line. All these three lines should form a smooth straight line without any discontinuity. B stands for bone, where you look at the bony outline of each vertebrae and bone density too. Any discontinuity in the bony outline indicates there is a suspected vertebral fracture. C stands for cartilage, where you look at the cartilaginous part, which is the intervertebral space where the intervertebral disc is situated. If there is any intervertebral disc space narrowing, it indicates there is a cartilaginous injury. D stands for dense, where you look at the predental space. Normal predental space is around 3 mm. If there is any narrowing or widening of the predental space is there, it indicates there is a odontoid fracture or C1-C2 subluxation or a fracture in the C1-C2 area. E stands for extra tissue, where you look at the soft tissue shadow in the lateral X-ray. From C1 to C4, the normal soft tissue shadow is less than 7 mm or it is less than half of the cervical vertebrae in the corresponding level. C5 and below, the normal soft tissue thickness is less than 22 mm or it is less than the width of the cervical vertebrae in the corresponding level. F stands for facet joint, where you look at the facet joint and interspinous distances. If there is any narrowing or widening of interspinous distance, it indicates that there is a suspected ligamentous injury in that corresponding level.